Today we're discussing the work of Cuban doctors around the world amid the pandemic with a member of the medical mission in Grenada. Trinidad and Tobago won't open its borders anytime soon to prevent the spread of COVID-19. And protests in Lebanon continue for the second day despite the coronavirus lockdown. Hello, welcome to Telesur. I'm Carla Gonzalez and this is from the South. Trinidad and Tobago does not intend to open its borders anytime soon. The Minister of National Security said this was to prevent the importation of second and third waves of COVID-19.
Our medical experts have advised that this measure is a necessary measure and we will continue to keep our borders closed. Second waves. Persons who are observing what is going on, as we in the government are around the world, will note that anyone who started to relax their border control and allow persons to free flow or even restricted flow across the borders to certain categories, for example, their nationals, immediately began to experience a second wave that can be worse than the first wave of infection from COVID-19. The Minister of Health referred to a few moments ago. Singapore, one of the points of everyone looking at a few weeks ago, started to ease on their restrictions with their border control. Immediately a second wave hit them. Japan, states of emergency across their country, unfortunately, again because the easing of restrictions. South Korea, and there are a number of other jurisdictions. Bearing all of that in mind, after consulting with our medical experts, we have no intention at this stage to allow our borders to become porous and allow persons a free flow of access.
Bermuda has a total of 98 COVID-19 cases after recording 12 new positives on Tuesday. Of those new cases, 11 were imported, with the ages ranging from 18 to 91 years old. Thus far, 38 patients have recovered from the illness, while 10 remain hospitalized. According to the government, 44 people are either at home or in quarantine. Meanwhile, the death toll remains at 5. Grenada is among the 20 countries around the world where Cuba has sent medical missions to help combat the COVID-19 pandemic. For now, we have Dr. Darges Maya Lepkes, member of the Cuban mission in Grenada, to discuss their work. Thank you for joining us, Dr. Lepkes.
Thanks to you.
So, can you tell us more about Cuba's Solidarity Program? We know it's not just in the Caribbean, but it's also around the world.
Yes, but basically we have 35 Cuban doctors and nurses and other staff working together with all the Grenadian doctors and the Ministry of Health for many years. And also we are working together with all of them on that situation that we have currently now with the COVID-19.
Doctor, what has been the response of the people in Grenada once you arrived to the country?
Repeat the question again.
What was the response of the people in Grenada to the help from the Cuban Medical Brigade?
But the response of the people in Grenada respect to us is that basically we working and to manage all the situation we have here in Grenada. However, we're working together with the government and the health authority with the population to prevent the spread of all of the COVID-19. And what we planning now is we doing social isolation of the population in Grenada to prevent the spread of the COVID-19, and also the Ministry of Health of the country implement a curfew for 24 hours, except for different days that the people go and get grocery on the supermarket, or they can go to get some gas, and only the people that he have permission to go outside his house is um, the essential worker, like doctors, nurse, and the people that he work in the supermarket, and the police, and etc.
And Doctor, Cuba continues to have a blockade by the United States, and you can't get some medical equipment. We've seen reports that many countries have been blocked from receiving medical aid. Is that affecting your work in Grenada?
But right here in Grenada, and that, what I can say that is the restriction in all the world is for everybody, not only for Cuba or Grenada or China or UK. But however, we working with what we have here in Grenada. We have all the necessary supply to help and give medical treatment or for all the people that have COVID-19, or for prevent or for the prevention, because prevention is the most important in to to prevent the spread of the COVID-19. Basically, here in Grenada, we have the necessary resource, not everything that we want to have, but we have the necessary, and the ministry and the government, he give to us all the support and everything that what we need to prevent the spread of the COVID-19. Currently here in Grenada, we don't have too much people sick. The the spread is low, but we working together with the ministry and the government and the population to prevent that become more seriously.
Indeed. Thank you very much for your time, Doctor, and we wish you, of course, luck and that you can continue this work. Thank you very much.
Thank you.
We'll be speaking to Dr. Dalges Maya Lepkes. He's a member of the Cuban Medical Brigade in Grenada. We're taking a short break now, but don't go away. We'll be right back. Welcome back. More news at this hour. In Argentina, at least 12 elderly people have been evacuated from a Buenos Aires nursing home after various staff members and residents tested positive for COVID-19. Authorities say at least 6 elderly residents and 1 nurse have tested positive for the virus so far, but they are still waiting for the test results of the rest of the residents and personnel. As of Wednesday, Argentina registers more than 3,100 cases and 152 deaths.
We managed to get them all transferred because they had no medical assistance here. 72 hours ago, they were absolutely abandoned. We do not know in what situation they actually left, what type of medication they had, how they are.
In regards to isolating them, it's difficult because it's necessary to isolate each one in one room. And it's not possible because if I have more patients than rooms while strictly complying with the building protocol, we can't. It's a factual impossibility. This situation was revealed to the Buenos Aires city government. But above all, the point was the lack of staff members. The nurses were infected. We were desperate.
Health authorities in Brazil carried out the first trial run of mass testing for COVID-19 in Brasilia. The plan is to carry out 100,000 rapid tests until Friday, the equivalent of 3.3% of the population of Brasilia, a city of 3 million people. This process takes just minutes and can be done without people exiting their cars.
We're going to start with 100,000 tests, which is around 5% of the population of the federal district, but we will test up to 15%. The idea is to do 450,000 tests, which give us a lot of security regarding any measure and any decision we intend to take over this period.
In addition to being from a risk area, I'm a senior. My wife works in the health sector. She works frequently. She is a nurse. There is a risk that she brings the virus home. We have a pregnant woman at home. We really need to be careful to avoid transmitting it to others.
Latin America and the Caribbean is set to experience the region's worst recession in recorded history as a result of COVID-19. The International Labour Organization says LATAM will see a fall in GDP of 5.3% in 2020 due to the pandemic. Additionally, 61% of Latinos working in the United States have lost their jobs as part of their salaries, according to a study by the Pew Research Center. The head of the UN's World Food Programme is warning that as the world is dealing with the pandemic, it is also on the brink of a hunger pandemic, adding that even before COVID-19 became a global issue, the WFP had warned world leaders that 2020 would see the worst humanitarian crisis since World War II.
This might sound truly shocking, but let me give you just some numbers. 821 million people go to bed hungry every night all over the world, chronically hungry. And as Dr. Chu just pointed out, as the new global report on food crisis that's published today shows, there are a further 135 million people facing crisis levels of hunger or worse. That means 135 million people on Earth are marching toward the brink of starvation. But now the World Food Program analysis shows also, due to the coronavirus, that an additional 130 million people could be pushed to the brink of starvation by the end of 2020. That's a total of 265 million people. In a worst case scenario, we could be looking at famine in about 36 countries. And in fact, 10 of these countries, we already have more than 1 million people per country who are on the verge of starvation.
And agriculture ministers of the G20 countries held a virtual meeting and pledged to ensure sufficient global food supplies amid the pandemic. The ministers said, "We will work together to help ensure that sufficient, safe, affordable and nutritious food continues to be available and accessible to all people, including the poorest, the most vulnerable and displaced people." They also said it was important that coronavirus restrictions do not create unnecessary barriers to trade and food supply chains. Mexico's Deputy Health Minister Hugo López-Gatell says the country has entered phase 3 of its containment efforts to control COVID-19.
Today we want to declare the beginning of phase 3 of the COVID epidemic, keeping in mind we are in the phase of rapid ascent where there will be a great number of cases of contagions, of hospitalizations, but that we must continue to maintain the national path of healthy distance so that these are kept to the minimum possible.
Meanwhile, doctors and nurses across public hospitals in Mexico have continued to protest and demand protective equipment. The healthcare workers blocked the entrance of the Institute for Social Security in Mexico City. They also expressed concern over the rising numbers of medical staff infected with the new coronavirus. Panama City's Metro has started to implement thermal cameras in stations to detect possible COVID-19 cases. The infrared cameras are installed at the entrance of the city's metro system and near the turnstiles. Authorities in charge say this is one of the ways in which public transport will forever be different across the world. Panama at the moment has the most infections for any country in Central America.
It is a thermal camera that has real-time video so that the operator can identify people with high temperatures and quickly follow a protocol.
The pandemic will change the way we move, the way mass transport works. Mass transport will change. Taking temperatures is one of the important measures, coordinated through the national government and the health ministry.
We have more stories coming up. We'll be back in just a minute. Kingdom, the recently appointed labor leader has slammed the government and accused it of giving a slow response to the coronavirus. He said the ruling party has failed to increase testing to control the spread of the virus.
Testing is obviously crucial at every stage of the pandemic. But we have been very slow and we're way behind other European countries. Now, the Health Secretary made a very important commitment to 100,000 tests a day by the end of April. But yesterday, the figure for actual tests was 18,000 a day, and that was down from Monday, which was 19,000 tests a day. So we're way behind the curve, and the end of the month is a week tomorrow. So what does the First Secretary expect to happen in the next 8 days to get us from 18,000 tests a day to 100,000 tests a day?
Our correspondent, Paolo Navarrete, in London, has more on the situation in the UK.
The number of people that have died due to coronavirus in the UK could be as high as 41,000 people, according to an article published by the Financial Times today, Wednesday, in the UK. Now, the article has taken figures from the Office of National Statistics, which is the UK's leading provider of national statistics. It is tasked with carrying out the census in England and Wales every 10 years. It's taken the figure, which includes deaths from hospitals and outside hospitals. Now, the UK government latest figures for the deaths due to coronavirus are 17,337 as of yesterday, Tuesday. Now, these figures don't include hospital deaths. The new figure, which is more than double this figure, takes into account hospital deaths and looks at the recent trends in mortality. For example, on the week ending April 10th, it appeared that 75% more people died than would be expected. Now, this article comes in the context of increasing criticism of the Boris Johnson government's handling of the crisis. On Sunday, the Times, which is normally pro-government or sympathetic to the government newspaper, published an article which suggested that Boris Johnson hadn't taken the threat of the coronavirus sufficiently seriously, had dealt with it in a rather complacent manner, and now with a high number of deaths in the UK, perhaps this complacency is being translated into the high death rate that we are seeing, making the UK one of the countries in the world with the highest per capita deaths due to coronavirus.
That was Paolo Navarrete from London. In other news, activists have rejected the announcement by US President Donald Trump that he will sign an executive order to temporarily suspend immigration. He said this will protect US jobs during COVID-19.
Well, once again, President Donald Trump is seeking to distract the nation with his tweet that attacks immigration and attacks immigrants. This is not an issue that should be brought up at this moment. This is a moment in which the President of the United States should be working with our governors and with our local elected officials to safeguard lives. In this moment, I think that we as Americans need to see this for what it is, which is a distraction, and it's just one more call to racism, division, and xenophobia.
There's no merit in any such planned executive order. It's been demonstrated time and again, immigrants are job creators. They're a net benefit to the economy. And, banning the immigration of any person in the United States except for agricultural workers, it's not going to solve the coronavirus pandemic. It's going to leave us with a shortage of healthcare providers, people that are involved in transportation, pharmacy, grocery. It puts us at a disadvantage. It's not going to help us out of the problem Trump's made in mismanaging this pandemic. It's a distraction.
Germany's capital, Berlin, has joined a wave of federal states that have ordered residents to wear protective masks on public transport effective April 27th. This comes as the country has started to relax some of its measures to stem the spread of COVID-19. Members of the public have started to slowly return to the streets as shops under 800 square meters have been permitted to reopen in Berlin. Meanwhile, Germany has cancelled Oktoberfest, the famous beer festival in southern Bavaria, over the coronavirus. The event was scheduled for September 19th to October 4th and was expected to draw some 6 million visitors. Japanese authorities announced 34 crew members on an Italian cruise ship docked in Nagasaki have tested positive for coronavirus. The Costa Atlantica ship has been docked in the southern port of Nagasaki since January for maintenance. On Tuesday, one crew member was confirmed to have the virus. Officials said none of the 623 crew members have showed serious symptoms, and now they are being self-quarantined in single rooms.
On this cruise ship, there are no passengers and only crew members of about 600 people aboard, from what I understand. On April 20, tests on 4 people were conducted and 1 person tests positive. On the 21, tests on 57 people were conducted, and I have received information that 33 people test positive.
The death toll from the 14-hour shooting rampage that jolted Canada over the weekend has risen to 22. The victims include a 17-year-old pregnant healthcare worker and a veteran officer of the Royal Canadian Mounted Police. The 51-year-old male suspect was killed by law enforcement after he created 16 separate crime scenes in Nova Scotia. During the attack, he wore an authentic RCMP police uniform and drove what appeared to be a police vehicle. Protests in Lebanon continue for the second day despite the coronavirus lockdown. Hundreds of demonstrators drove around Beirut in a show of rejection for the political leadership, whom they blame for the country's economic and financial crisis. The protests coincide with a second day of a parliamentary session where lawmakers are discussing the creation of an anti-corruption commission and legalizing the cultivation of cannabis for medical and industrial use.
We are here today protesting against the proposed general amnesty law that has a lot of defects. Lebanese legislators are trying to approve this law to protect themselves of the corruption that they are guilty of.
Buses in Nepal have begun taking workers from Kathmandu back to their villages after the Supreme Court ordered the government to take responsibility for getting workers home amid the COVID-19 pandemic. Since Nepal went into lockdown on March 24th, thousands of people in Kathmandu had been trying to return to their home districts as they were left without resources for food and shelter in the capital. When COVID-19 emerged, the Nepalese government was quick to close the Himalayas for the popular spring climbing season, which lasts from March to May. This meant an estimated $4.4 million loss, which the country earns from permit fees from people hoping to scale Mount Everest. Iran has announced it successfully launched the country's first military satellite. It is the first time the Islamic Revolutionary Guard Corps took credit for the launch of a military satellite, and it takes place after several failed launches in recent months. Wednesday's launch comes amid tensions between Iran and the United States over its collapsing nuclear deal, and after a U.S. drone attack in Iraq killed Iranian top general Qasem Soleimani in January. And with that, we end our news brief, but you can find these and more stories on our website, telesurenglish.net. And be sure to follow also on Facebook, Twitter, and Instagram. For Telesur English, I'm Carla Gonzalez. Until next time.